Hello and welcome. My name is Robin and I'm a public health nurse with Southwestern Public Health. We know you're busy and we appreciate you taking the time today to view this video on outbreak control. We hope you find our time together valuable and that you will share this video with your colleagues. This educational video will cover the following topics: outbreak recognition and reporting, and outbreak management. Now, let's get started. Have you noticed an increase in the number of residents with new or unexplained respiratory or enteric symptoms, such as fever, cough, runny nose, sore throat, vomiting, or diarrhea? If you answered yes or maybe to this question, your facility may be in an outbreak. Call Southwestern Public Health at 1-800-922-0096 and speak to the public health team member assigned to your facility, or dial extension 3500 and ask to speak with the member of the Infectious Diseases Team. Southwestern Public Health will collect details about the ill residents, such as symptoms and onset dates, and will determine if your facility is in a suspect or confirmed outbreak. During suspect and confirmed outbreaks, Southwestern Public Health will provide outbreak control measures to the infection control lead at your facility. The outbreak control measures should be posted at the nursing station and in other common areas for all staff to see and review. The first page of the outbreak control measures provides basic information about the outbreak, such as the outbreak number, the outbreak facility name and contact information, the outbreak pathogen once identified, the outbreak case definition, and the outbreak definition. The remainder of the document are the outbreak control measures. The outbreak control measures are the things we do to protect staff, visitors, and residents from getting sick during the outbreak.
Hi, my name is Chad and I'm a public health nurse at Southwestern Public Health. Let's look at 3 of the key control measures for use in facilities such as long-term care homes, retirement homes, and congregate living settings. The first key outbreak control measure is tracking cases and reporting to public health. Are you new to completing line lists? Ensure you complete the case details thoroughly. Include the case name, birth date, unit and room number, symptoms, onset date, laboratory details, vaccination dates, hospitalization details, and complications. Don't forget to include the symptom resolution date and out of isolation date on the right-hand side. The second key outbreak control measure is case management. Symptomatic residents should stay in their rooms. The length of isolation will be determined once the outbreak pathogen is known. For ill residents who are sharing a room with another resident, draw the curtain, ensure adequate bed space, increase ventilation, dedicate equipment, and encourage masking by residents as tolerated. For further direction on managing asymptomatic roommates, speak with your Southwestern Public Health outbreak lead and/or refer to the outbreak control measures. Ill staff should not go to work. As previously mentioned, it's important to identify the outbreak pathogen so that up-to-date return to work recommendations can be provided. As directed by Southwestern Public Health, collect samples from ill residents and staff. For additional information on this task, you may want to watch our specimen collection video. Small group activities are permitted for well residents on the outbreak unit. Large group activities, including outside entertainment, should be postponed on the outbreak unit until the outbreak is over. Ill and well residents may attend urgent medical appointments and/or appointments that cannot be rescheduled. Notify the medical office, provide a mask to the resident, and assist the resident with hand hygiene. Ill and well residents should not leave the facility for social reasons and outings. Please discuss this further with your Southwestern Public Health outbreak lead on a case-by-case basis if necessary. Non-essential visitors should be encouraged to postpone visits until the outbreak is over. When this is not possible, the visitor should be aware of the outbreak and control measures in place use the appropriate PPE, and only visit one resident. Finally, encourage residents, staff, volunteers, and visitors to stay up to date with their COVID-19, flu, pneumococcal, and RSV vaccinations if eligible.
Hi, my name is Kitty, and I'm a Public Health Inspector at Southwestern Public Health. The third key outbreak control measure is routine practices and additional precautions. It's important to know what PPE should be worn during an outbreak. During a respiratory outbreak, regardless of the outbreak pathogen, N95 respirator and eye protection should be used for the duration of the outbreak when providing direct care or interacting with any resident within 6 feet on the outbreak unit. Staff should also wear gown and gloves based on point-of-care risk assessment. During an enteric outbreak, N95 respirator and eye protection should be worn when providing direct care or interacting with ill residents until COVID-19 is ruled out. Once COVID-19 is ruled out, staff should use gown and gloves when providing direct care to ill residents and use medical mask and eye protection based on point-of-care risk assessment. Staff, resident, visitors, and volunteers should perform frequent and meticulous hand hygiene. When hands are not visibly soiled, alcohol-based hand rub containing at least 70% alcohol is preferred. Soap and water is preferred when hands are visibly soiled, or after using the washroom, handling garbage, or during food preparation. The frequency of cleaning and disinfection of high-touch surfaces such as door handles, call bells, elevator buttons should be increased to twice daily during outbreaks. Hospital-grade disinfectant is sufficient during respiratory outbreaks. Intermediate or high-level disinfectant is required during enteric outbreaks.
We have now reached the end of our educational video on outbreak control. We hope you found the information helpful. For additional resources, including our decision-making trees on managing ill residents, our Outbreak Quick Reference tool, our line list and control measures template, scan the QR code at the end of this video or visit our website. Early outbreak recognition, reporting, and implementation of control measures are key in preventing ongoing spread of infection. Thank you for everything you do. Please call Southwestern Public Health if you have any further questions about outbreak control.